a heads up, big changes to Medicare prescriptions are coming soon. Joining me now, Alejandra Rashan, benefits coordinator for the Houston-Galveston Area Council. Now, first, talk to me about this extra help program. As we were just talking about before they came to us, is that this is all part of the Inflation Reduction Act that we're going to see over years start to take place, correct?
Right, yeah. So the president signed this law back in August of 2022, and it is a 4-year rollout. So we are on the second year of changes, and I'm really excited to see what's going to happen in 2024.
And it's so exciting because the idea is that it's going to eventually lower our prescription costs, or at least cap them, right?
Exactly. So anyone that's on Medicare eventually will have a $2,000 cap on prescriptions, and that'll roll out in 2025.
Okay, 2025. That
Yes.
was going to be my next question. And yeah, I say we, but I mean because we know everybody knows somebody who's on Medicare right now. So how much could seniors on Medicare expect to save?
I mean, it could be in the thousands.
Oh,
you know,
okay.
on average, someone that's not on assistance, they could pay anywhere from $4,000 to $6,000, $8,000, $10,000 a year in prescription drug costs, depending on the tier levels of those medications.
That's true. So if it's capped at 2,000, then yeah, really, that's a huge savings.
Exactly.
Okay. What are some of the important things that seniors need to know, and where can they basically get more information about this?
So some things to note is that a lot of people don't check their benefits every year. With the Medicare open enrollment period starting in October, that is the best opportunity for someone to make sure that the benefits that they have this year will keep being cost effective next year. They can always reach out to either of the area agencies on aging that are in the Houston region. We cover the 12 counties that surround Harris County, and then City of Houston actually houses the Harris County Area Agency on Aging.
Mm-hmm. Is this ever personal for you? Like, are you excited that this is happening?
Absolutely, absolutely. We deal with so many people that, you know, call us for all of these prescriptions that they just can't afford. And as an advocate, it's very important to me to be able to give them at least a little bit of good news, especially with the expansion of the Extra Help program next year.
And that's a good thing to mention, is that you are a resource for people if they are overwhelmed by their drug costs, if they need help trying to figure out, is there someplace I could be getting this cheaper? You can assist with that.
Absolutely. We are an unbiased resource in the area. So because we are not insurance agents, we are never going to put a personal spin on any of the suggestions that we make. At the end of the day, we just help the beneficiary make a knowledgeable decision on their benefits.
Yeah. Yeah. And my personal favorite is when insurance says, you know what, we're not going to cover this drug that you need to live anymore, you know, and then people really feel lost and they feel overwhelmed. And so you're a great resource for them.
Absolutely. Absolutely. We're happy to help.
All right. Anything else that you want to say about the Inflation Reduction Act? Anything else that we can expect to see soon?
Yeah. So 2024, the Medicare or the Social Security Extra Help program would be expanding to 150% of the federal poverty level. It'll cover 100% of the prescription program for folks. So it would take away premiums, it would take away deductibles, and co-pays would be very low. And then the 5% catastrophic coverage that happens after the donut hole or the coverage gap will go away next year.
I am so anticipating all of the health changes that the Inflation Reduction Act is supposed to eventually roll out over this like long time span. But sometimes it's like, you know, too much of a good thing sounds like too much of a good thing. So any challenges that you can anticipate ahead of time?
It not rolling out fast enough, honestly. I mean,
long overdue.
Long overdue. So I think just as an advocate, getting the news ahead of time and being able to tell the community and our beneficiaries that these changes are coming is just, it's difficult. So just be on the lookout for those changes.
Yeah, hang in there. Changes are coming.
Yes.
Alejandra Rashan, you are always a pleasure to speak with. You're a wonderful resource for our community. Thank you so much for what you do. And thanks for joining us this morning.
Thank you for having me.